Greetings, everyone. This is Sam Collins, the coding and billing expert for acupuncture and the profession, meaning American Acupuncture Council, and you. I'm getting a lot of questions. As being an expert dealing with lots of issues from writing articles, I get people asking all the time, how do we make sure we have medical necessity? I'm having insurance carriers that are coming back and pushing back on some providers, or they're requesting additional information. How do we define it? But I want to go beyond just the carrier. What really is acupuncture medical necessity? How is that defined? Let's go to the slides. Let's get into that a little bit and start to give you a good understanding of how do you want to start to approach this, or at least begin to define it so you can define your care. What is acupuncture medical necessity? In fact, who says? Well, of course, you can have the patient. The patients are going to determine medical necessity. Whether or not they want it or not is going to be part of the necessity. Does it make them feel better? Who also determines it? Well, you, the provider, the doctor, if you will. You're defining it. How do I define it? What is it that the person should feel? What should they be better about? Or what are we doing? Are we just getting rid of pain? And then, of course, we have to deal with it from an insurance standpoint. And how do we meld all of these things together to start to bring to what really is a necessity and how we might define it maybe slightly differently depending on who it is? Well, from a patient standpoint, think of it this way. A patient's going to say, it makes me feel better. It has value. Well, if you can have a person that had migraines and they come to you now and their migraines are 75% less or not at all, there's a value. They're going to pay you for that. That is something that they see a value proposition for. Do keep in mind, though, people do things, and this is something my mom always defined. That's why I'm quoting her. She says people buy what they want and beg for what they need. Have you ever had someone borrow money from you before? Maybe they'd pay rent or something. And then they haven't paid you back, but the next time you see them, they're wearing a brand new pair of shoes. And you're thinking, wait a minute, how they buy a new pair of shoes, haven't paid me? Because they begged for what they needed, which was to pay rent, but they bought what they wanted, what were shoes. I want you to think of, for cash patients, you have to be the shoes. The person wants it because there's enough value. How do we create the value? Because they feel better. They can see the change. So realize that even applies, and of course applies for insurance, or excuse me, for cash, but even insurance to an extent. Remember, some insurances pay really well, but what about the ones that don't? High deductibles. We have to create that the patient can see the value. For me, for acupuncture, this is where I think our biggest growth can be. As people try acupuncture, they begin to realize how much it works. Realize that in the VA, while not very many people are seeking out the VA benefits, but do you know for people who do get VA, 38% are going to acupuncturists. What are the responses? It's very good. Why wouldn't a VA patient want it when they can see it makes them feel better? Because at the end of the day, it's treating someone to get them to go, oh, there's the value. There's no longer fear. So bottom line is, a patient defines it, did it help me? And how do we define help? Well, always by, do I feel better? Does it have me less pain? And that's going to be either with insurance or cash. But create that so the patient understands what are the expectations of care. And then, of course, it's how you define it as the acupuncture provider. What are you defining it as? As chi or energy, the very more of a traditional medicine basis? Or are you going to go just into, hey, let's talk about it from pain or dysfunction? In fact, if you have a loss of chi, what is it going to mean? Maybe a loss of energy, but pain, dysfunction, functional change. And so setting up what the expectations are. What are your goals? So if someone comes in with a headache, what's the goal? No headache, lesser headaches, less intense, less back pain. I had someone that completely didn't want to go to an acupuncturist a few weeks ago, an athlete I recommended. I don't know, I'm afraid of needles. I said, you got to try it. Turns out acupuncture has helped her, and in fact, she was able to compete this past weekend and win a medal at the World Championships. Bottom line is, once people try it, they know it helps. Well, here's the end of the day. How are we defining that? I think it's mostly getting to people so that they can see that the care is helpful. At the end of the day, necessity is, I got to feel better. Acupuncture really is genius and simple. How does the body communicate when something's wrong? The body almost always communicates with some level. I don't care what, he could be cancer. You're going to have pain. So therefore, acupuncture, I think in its genius, has always focused on that communication. But that communication, we can go beyond to say it's not just about pain relief, but long-term health. Changes to be healthier. Well, let's talk about it from an insurance standpoint. What do they see it as? How do they define it? Well, insurance says, well, of course, we know obviously, well, it's pain. It could be acute, chronic, nausea, vomiting, pretty well covered as well. But it has to be medically necessary, must be delivered toward a defined response, something evidence based, like I can show that the patient is better as a result, meaning they want a continuation of treatment that is contingent upon progression towards defined treatment goals and evidence by specific, significant, objective functional improvements. And again, this goes back to outcome assessments. If you're not using outcome assessments as an acupuncturist, you've got to begin. It's the easiest way to define your changes. It's the one most accepted because it's right there. It's black and white. The patient started off with a 70% disability, and after 3 weeks of care, they're down to a 30%. Yeah, you've made them better. Evidence-based is going to be your basis. And it says ongoing services, including monitoring of outcomes of progress with a change in treatment plan or withdrawal of treatment if the patient is not improving or regressing. So in other words, simply put, if the person is not improving, it's not medically necessary. There's got to be a change. Now, you could argue, well, without the care, they would get worse. Well, here's what is said. Once the functional status has remained stable for a given condition, without expectation of additional functional improvement, any treatment program designed to maintain optimal health in the absence of symptoms or in chronic conditions without exacerbation of symptoms. In other words, now it's maintenance. Now, I'm a believer in health. I mean, when you really think of when we say health insurance, is that what we're really saying? Or are we saying sick insurance? And therein lies the difference. And this may be the bridge of getting a patient to understand, are we going to wait for you to get sick? Or are we just going to keep you healthy in the first place? I mean, why eat healthy food? Why go to the gym? Why to have a better lifestyle? All those things are part of health, but we have to start to define where does insurance fit? And it doesn't always when it comes to healthcare. And there's going to be a defining difference of getting the patient to understand, which means we've got to really understand it from this standpoint. What are the expectations? Pain. Decrease it, make them feel better. The body always responds that way. Now, there's some things that may not be associated. I mean, there are some carriers now that even cover PTSD and anxiety, and maybe they're not painful, but there's an outcome of change because there's improvement. And I don't care what you have. If you make a person better, they're going to have better function. Functional improvement, though, best defined by clinically meaningful improvement on validated disease-specific outcomes. If you have a headache, use the headache index. You have PTSD, use that index. Low back, use that index. There's all types. If you're a member of our service, we've got them all on our site for you. Here's the bottom line is, show me how the person is better and what they can do in their life or activities of daily living. Of course, any reduction in pain medication, we are the society of drugs. I mean, how many times do you watch a TV show that they're advertising a drug? They don't even tell you what it's for, but just say, you better look. What about a decrease there? Let's keep the person healthy. And then objective measures demonstrating the extent of meaningful improvement. So again, always focus on the patient improving because it says here, additional treatment or as an example to reach further durable improvement or ongoing management. It's got to be improvement, not stabilization. And of course, anything that you think is causing the patient to have this recur is going to be an important part because there is a difference between purely supportive care, meaning I'm keeping them even, or flare-ups. Flare-up comes, so we calm it back down. Bottom line is medical necessity is defined by, am I making a person better? But who is defining it will determine the payment. A patient will define it easy. You're making me better out of pain, but once I'm stable, the value's not there. Where do I fit for insurance? Kind of the same way. Your goal, do what you do well for your patients. Get them better. Define it in ways that people can see it objectively and in ways that you can repeat. Ultimately, continue doing that job. The more access people get to acupuncture, the more you're going to see more people because realize once a person goes into acupuncture, it's like, oh my God, I didn't think that was going to work. That's really our goal. We're seeing it in the VA and other places. Your bottom line is defining necessity by your methods, by improvement, and melding all of those together. They're not exclusive, but certainly you're going to have a lot of patients that may not have coverage. Medical necessity is they feel better. That's what you do. I wish you well, my friends, and I'll say the American Acupuncture Council, our network is always there to help you. In fact, we have an upcoming webinar on VA. You can watch it and view it. I want to make sure that you're doing as best you can to utilize your business as your means of a good lifestyle. But the thing you really like doing is helping patients. Till I see you again.